Good morning. Myself, Dr. Vipul Gurjar. I am the head and a professor of the surgery in SBKS Medical College, Vadodara. Today, I am going to start about the series on laser. It is a very good tool and newer tool for all the surgeon who are doing anorectal surgeries. Initially, it was introduced for the dental and skin. Now, then later on the endovenous surgery, and now the many procedure we are using. Laser, it is a diode laser nowadays available. It is advocated for the use of proctology, endovenous system, non-healing ulcer, as well as hair growth surgery also. It works with the photoablation, photoabsorption, photothermal, photodisruption, and then it becomes cause a photochemical and plasma induced ablation. Everyone has to understand about some step of basic thing of laser. This basic thing will help you to come out from your complication when that will occur, or it will prevent the complication. If you are knowing about basic thing about the principle of laser, fiber tip, fiber machine characteristic, then there won't be a minimize complication with your hand. So I recommended you to spend 5 to 10 minutes to understand about the basic thing, and every time the basic is always a somewhat a headache and it is non-interesting topic, but only 2 to 3 minutes please give me. Definitely then after you practically approach, you will definitely love to hear this laser topic. Okay, now the result of laser will be a different one. Sometimes many persons are coming with me, sir, I don't have a that much effect on my pile surgery. You have suggested me start with the kind of repeated mode, and I have kept. Company has advised me to keep machine at 6 watt, and I have given, but the surgery is not worked out. But mind well, the result of a laser depends upon the tissue interaction, how the tissue interact with the laser. That means the fistula and piles cannot be compared tissue. Laser wavelength, that means machine is on 6 watt, 7 watt or 8 watt. The target tissue characteristic at where you are giving the laser, and exposure time, that means duration. You have to keep that duration according to your experience, then and then you will get a good result. Now, photothermal mechanism. Laser works with the photothermal mechanism. What is this? Laser convert light into heat. At the tip of laser, heat temperature reaches up to 80 to 100 Celsius in ideal situation. Okay. While in our cautery, tip temperature may reach up to the 300 to 400, and this laser light absorbed by the chromophore in the tissue like a protein, hemoglobin, and the water. This absorption may lead to tissue denaturation and destruction of the tissue. You know, the protein denature start at what temperature? 65 to 80 Celsius degree. And our laser reaches up to the 80 to 100. That means we are going just high about normal starting of tissue denaturation, and that's why we get adequate tissue destruction in an ideal situation. Nowadays, 1470 nanometer wavelength is available machine, and it is 60 times more potent, more effective than its previous version of 980 in proctology itself. See, we are discussing more about the proctology. That's why I am saying it is 1470 is a comparatively ideal than the 980. If you have a 980 and if you are having a good number of anorectal patient, then please upgrade this wavelength up to the 1470. Now another wavelength is also available, that is a 640 or 650. It is known as a low laser therapy, and it is used for the healing of the surgery. That means if your ulcer is not healing, then if you apply this 640 650, then it increase the healing of the surgery, while 1470 it is meant for the destruction of the surgery. In a laser machine, two type of mode available. When you see the screen, there will be a two thing: continuous single as well as repeat. That means a pulsatile mode. What is continuous mode? If you press this continuous mode, if you start this machine at the continuous mode, it produces constant light beam with no or minimal power variation. It is mainly used for the fistula and the pilonidal sinus surgery, or to cut the skin it is required. But there will be a constant disbursement of energy. So the heat production is and tissue destruction is more. While the pulsatile mode, it is available in two port, the single pulse or repeated as single pulsatile mode. Okay. Before that, I want to clear about the thermal relaxation time. What is the thermal relaxation time? It is very useful for the pile surgery when you are getting a problem of ischemia, burning pain. Then this principle you have to understand, that is a thermal relaxation time. This thermal relaxation time is the time taken for the target to disperse energy 63%. That means once tissue is getting the energy, and 1 second pulse come for the energy in the pulsatile mode, in between these two periods 63% of energy will be dispersed from the tissue. That means it decrease the production of the heat, and its time range from the nanosecond to hundred of millisecond. So, and it depends upon the tissue also. If you are using this pulsatile mode in a fistula and in the piles, there will be some difference of this thermal relaxation time. When laser used in continuous mode, its heat exceeds its thermal relaxation time. So this excess heat spreads to nearby tissue and causing the mild collateral damage in compared to pulsatile mode. Okay. This transferring heat to neighboring tissue is restricted when light emits in pulsatile mode. Okay. So, if in your case mucosal burn is more, post-surgical burning pain is more, it is bleeding from the necrosed pile mass, then you need to switch over your continuous mode to pulsatile mode. Okay. Okay. Many surgeons come to me that, sir, nowadays laser is working. Laser is the people are asking about, patient are asking about the laser surgery. Should I buy or not? The answer is yes. And which company? I do not recommend these particular companies, but you should buy the machines from the companies which is with you, which is available easily, which is well maintained, as well as in a financial support also, we should try to buy from that company only. Now, many other questions are arise that it is costly and it is required maintenance. No, it is not costly that much because you are investing the machines very small amount, but like if you are doing a laparoscopy surgeon, the investment is so big. If you are taking a good light also, if you are taking operation theater also, operation table, these are our investment that will give us earning. So there is nothing like about the cost, as well as maintenance. It is definitely as maintenance free for a long term if you are buying with the friendly company. Now, what are the advantage of a laser machine, particularly about the Anorectal? It is less costlier than our other gadgets, less costlier than the MIPH if we are using as a piles surgical tool. Nowadays patients demand, patient को skin take होगा तो भी they wants excision with the laser only. It's a demand. And shrinkage of pile is a reality. On follow up, if you are giving a good adequate laser energy to pile mass, and if you are following your patient at the end of 2 to 3 months on proctoscopy, you will definitely get a flat mucosa. So it is a reality. It is a scarless in compared to hemorrhoidectomy or other thing. It is a newer technology. We have to be get updated always with the newer technology. Less painful if you as a use as a cutting over the cautery machines, and less surgical bleeding. Now, what are the disadvantages? Always, every procedure has their its own merits and demerits. That means disadvantage होगा ही. So, what are that disadvantage? It is a new technology, so need of to learn about some basic principle of energy, fiber, its complication, and there is a no standard is protocol is available, as well as it is painful. If your patient is asking you, then it is painful. Yes, it is a energy, it is a heat, so always it is a painful. It never be a painless. If you are doing because of the painless, then if you are wrong. It definitely and 100% they may give some pain to the tissue. Delayed bleeding, yes, it is possible, delayed bleeding, but it may be a mild one, and it is easy to tackle. And occasional infection. Nowadays, I don't have that much cases of infection in my practice, and it is not ideal for the circumferential prolapsing piles in as a alone. If you do with the hybrid technique, then you can do in a circumferential prolapsing piles also. So my advice, you should buy laser. Don't worry, सर्जन फ्रेंडली कंपनी को आप पकड़ो. Do not afraid about their complication because it is a very minimum, and get more technical tips from your friends and your colleague to prevent that complication on initial practice. It is also useful in a diabetic food. It is one of the another cases what we are getting in a general surgery routine practice. So we'll go ahead in the next lectures about the fibers and everything. Thanking you. Thank you. Bye.